How to test for hypothyroidism. What lab tests is your doctor going to check? What lab tests are they not going to check that maybe you should ask for? And maybe even if you already have hypothyroidism, maybe you already have a diagnosis, what are some labs that you should be asking for, especially if your TSH is normal but you still don't feel well? We're diving into all of that on the podcast.
Welcome to She's Healthy, a podcast for ambitious women on their journey to become the healthiest version of themselves. I'm your host, Lori Aikman.
Welcome back to the She's Healthy podcast. If this is your first time listening, my name is Lori Aikman. I am a nurse practitioner in Florida, and I am the founder and CEO of Crown Executive Health, where we help busy professional women regain and sustain their energy through a functional medicine approach and really comprehensively managing their hormones, just everything so much. If you haven't listened to the podcast before, so much of the symptoms that we're experiencing today are largely due to our hormones. And so my goal on this podcast is just to help you understand your body better so that you can actually feel like yourself again, feel good again. I talk to so many women who tell me they feel like they're living in somebody else's body. They don't recognize their body anymore. And they're going to the doctor, they're seeking help, they're seeking answers, and just getting dismissed and left feeling hopeless. So that's my goal with this podcast. So if this is your first time listening, I hope that this is super valuable for you. And please share this with other women that need to hear it. So I will let you know, we try to keep these episodes 20 to 30 minutes. So it's something you can listen to easily in the car ride or something like that. And I do have to give you my medical disclaimer before I dive in. I am a nurse practitioner, but this podcast is just for informational purposes only. It does not constitute direct medical advice. So I do recommend that you work with your practitioner, your doctor, your provider before you make any changes to your plan. But learn from this, please, please, please. That's why I'm putting this out here, is just to help you again. So again, today, we're in the middle of a series on thyroid. So we've 2 episodes in, we talked about signs of hypothyroidism. Sorry, I should specify. We're talking about hypothyroidism. I will touch on hyperthyroidism after we finish the hypo part. But we're talking about underfunctioning thyroid just because it's way more prevalent. And there's a ton of people walking around with underfunctioning thyroids that don't know it and don't have an accurate diagnosis. Maybe they are. I saw so many women when I was working in family practice setting before I got into functional medicine. I saw so many women who would come in, and when they're having all these symptoms, they would say, I think it's my thyroid. Will you test my thyroid? And what we'll talk about today is a lot of the lab tests are just, people tell me, of course, they get their lab test done and then they have no answers. Everything is normal. But we're going to dive in today to why that might not be true and what are the tests that really we should be looking at. So, all right, here we go. So first, what I want to obviously the very first test, and you probably have had this one done at some point, is the TSH, so thyroid stimulating hormone. And if you remember back to our last episode, we talked about TSH is actually a hormone that's made in the brain that tells the thyroid to produce thyroid hormone. So this is the test that your doctor is going to do, where they're like, oh, okay, you're having symptoms. Yeah, we'll check a TSH. And typically, if your TSH is high, then it's like your brain is sending that signal and sending that signal and sending that signal to the thyroid and saying, hey, thyroid, make more hormone, make more hormone. So a high TSH means your thyroid is under functioning or is indicative of hypothyroid function, right? Hypothyroidism, versus if your TSH was low, so your thyroid would be producing more thyroid hormone. And so your brain, let's go back to this. It's like a little feedback loop So if there's a lot of active thyroid hormone being produced by the thyroid, your brain is going to turn down that signal, and your brain won't be telling your thyroid to make as much hormone because there's already a lot of hormone. So we'll see a low TSH in hyperthyroidism or overactive thyroid function. You can also see a low TSH if you are somebody who's on thyroid medication and maybe your dose is more than you need. You can see a low TSH. So I hope that makes sense. So think about it. It's like it's this feedback loop. It's this feedback mechanism. So how much active thyroid hormone is being produced by the thyroid is going to determine whether that TSH is high or low. Okay. I'll let you know, I'm not going to dive. I have a lot to cover today. I honestly don't know that I'm going to get to every test. I'm going to, again, try to give you high level overview. I want to let you know, actually, before I dive too much in, is that next week we are doing one of our Exhausted to Energized workshops for Crown Executive Health. So it's a free 5-day workshop for busy professional women. And it's called Exhausted to Energized because the majority of the women I talk to tell me they don't have the energy that they used to. So if you have, or you think you have thyroid disease because you're having fatigue symptoms, I want you to come to that workshop. I want you to sign up for that workshop, even if you're not able to be we do it via Zoom. Even if you're not able to watch live, we send out the replays. And what I'll let you know is that we're going to dive into labs and functional ranges of labs. So if you are somebody with thyroid issues, we're going to be talking about those optimal ranges of these tests. And so you could even take labs that you've had done and you could go through those and go, okay, well, I think I actually do have a problem, even though they're telling me it's normal or something along those lines. So it's going to be an awesome, I'm really excited about this workshop, I will tell you. So I'll put the link in the comments below or in the show notes below, just depending on what platform you're watching or listening to this, but really, really encourage you to join that workshop. It's basically like if you went and bought a book on women's health, I'm like condensing all of that and teaching it to you live, where you can literally ask me questions on the workshop. So it's totally free. It doesn't cost money. Just come, learn, improve your health, and live a better life, right? Okay. So, all right, we talked about TSH. Now back to that. So the next hormone we're going to talk about is T4. So we touched on this a little bit. So T4 is one of those thyroid hormones that is made by the thyroid gland. So again, TSH is coming from the brain to the thyroid and telling the thyroid to make T4. Okay. T4 is also known as thyroxine, but it is, also it is affected by our vitamin levels. So this is important. I'm going to give you little nuances for each of the labs we're talking about, because sometimes what we can see is that you have lower levels, but it can be from vitamin deficiency. There's going to be a bunch of different things that we talk about, but it doesn't necessarily mean that your thyroid is damaged and you have this irreversible thyroid condition. It can be that you just don't have the nutrients your body needs to make adequate levels of thyroid hormone. So again, this is thyroxine. I will tell you, so what you'll see is that you can have a total T4 and a free T4. And what that means is the majority of T4, when we test total T4, that's checking like all the T4 that's in the bloodstream, the majority of it is bound to a protein. So that's why the other one is called free, because it's not bound to the protein. So the majority of T4 is bound to thyroxine binding globulin, TBG. And then we have a smaller percentage that we can detect as a free T4 level. So you'll see those two different tests. And I will tell you, in practice, we ordered a lot from Quest Diagnostics. So in the family practice setting that I worked in, when I just found functional medicine, they had a test called TSH with reflux to free T4. So what that meant was we would test your TSH. if your TSH was abnormal, out of range, then they would run a free T4. But if your TSH was normal, then they wouldn't run a free T4 and you would just get a TSH tested. So if you're in a general, practice setting, that might be about what you're getting. It depends on your provider. If your provider is somebody who has, is into more endocrine function, or maybe you're seeing an endocrinologist, they may dive into a little bit of these other tests. But in your general like family practice setting, or I've worked at a weight loss clinic before, they just test TSH as like a screening type test. But as we go through, we'll see why that really isn't really showing us the full picture, and we need more tests than that, even if you don't have hypothyroidism, right? So we had that total, which is bound to protein, and then the free is unbound. And I will tell you, so I talked about this in the last episode. So T4 is really not a very metabolically active, meaning it doesn't really affect your cells as much as T3 does. So your thyroid, actually, the majority of the thyroid hormone it makes, like 80% or so, is T4. And then the other 20% is T3, which we'll talk about. And T4 eventually gets converted, or about 50% of T4 actually gets converted into T3. This might be why this is important, is because when we have these differing levels, when we test, it shows us, okay, what is actually going on with the body. But what I want you to know is, again, you want, getting a free T4 is going to give a better picture of like the more metabolically active forms of T4. Really want your free T3. But another thing to note is that if you have high levels of estrogen, this can actually affect your T4 levels. It can affect your T3 levels as well. But so high levels of estrogen, and what does that happen? Birth control pills, hormone replacement therapy, pregnancy, right, can falsely elevate those levels of T4. And then think if you're just estrogen, I see a ton of estrogen dominance. So I see a ton of women, when we actually measure their estrogen and progesterone, they have a lot of estrogen and not so much progesterone. So think about how that's going to affect their thyroid levels, and why, unfortunately, like talking through this, right, it can be kind of confusing, and like, okay, so no wonder if your doctor isn't well versed in this, you're going to be like, well, that was no help at all. They just told me everything was normal, or they didn't even test all this other stuff. It really can be complex, and just knowing these different things and how the hormones affect one another is really important in, one, improving our symptoms, and then two, getting an accurate diagnosis. So all right, let's move on to T3. So again, that T4, a majority of it gets converted to T3. And T3 is more our metabolically active. And what that means is T3 actually goes and makes its effect on our cells. And it particularly affects our mitochondria, which, just think of that if you ever took a like high school or college biology. The mitochondria are like your powerhouse of your cell that makes your energy. So when our T3 levels are affected, they're active, our metabolically active thyroid hormone is affected, that is why we have low energy levels, right? Is it's actually affecting the cell and affecting the energy that our body, like our cells, make, that helps us feel energized. Also affects our metabolism, right? When we talk about that mitochondria and cellular function and things like that, it's your actual metabolism. So how your body takes food we eat and makes it into energy. Okay. So that's why if you're like, oh, right, we know, okay, thyroid issues, fatigue, if we have hypothyroidism, we might have fatigue. That's why what's actually happening on a cellular level, that we actually have fatigue. So the majority, I will tell you, the thyroid actually only makes 20, might not care about this. The thyroid only makes about 20% of T3, and then another 80%, it actually comes from the conversion of T4 to T3. And I'll tell you why this is important, because there's vitamins involved and different things. But same for that T4. High levels of estrogen can falsely affect our T3. So again, in pregnancy, birth control use, hormone replacement therapy, but also like when we have a lot of inflammation or insulin resistance, or obesity. So being obese, which, World Health Organization definition is a BMI of 30 or greater. So when we have more fat cells are like their own hormone producing, they produce hormones, and just having more fat cells increases our amount of estrogen. And so that can then falsely impact our levels of thyroid hormone. So another reason why, okay, so I gain weight and I'm fatigued and I can't lose weight, and because it's this huge cluster of all these different hormones that get impacted. But other things, so again, and I guess why I bring that up is because we're going to talk about, when we get through the tests, like when should we actually test our thyroid hormones based on our cycle and based on what's going on with our hormones. So then another test you might see is something called reverse T3. So some people call this, like, it's like your body's like way to block or slow down your metabolism. So your T4 will get converted into free T3 or reverse T3. So reverse T3, what reverse T3 does is it goes and blocks the spot on the cell. So remember we talked about T3 will go and impact your cell, connect with your cell, and then it is affecting metabolism. Well, what reverse T3 does is it goes and blocks that spot on the cell where T3 would come and have your effect on your metabolism. And we do make reverse T3 normally. Let's see, under normal conditions, about 40 to 50 of T4 is made into reverse T3. But what's important is when we have high stress, high cortisol levels. I talk about this a lot on this podcast. So again, if you're new, stay tuned. I talk about that a ton. But high stress, high cortisol levels will increase our level of reverse T3. If we have chronic illness, inflammation, malnutrition, and that doesn't necessarily mean like starving children in third world countries. Malnutrition is right here in the US in eating food that doesn't have good nutrients in it, right? Think about all of our processed food. If we're like deficient in nutrients, that can actually increase our levels of reverse T3. Fasting can also increase our levels of reverse T3. Fasting is a topic that we will be addressing on the podcast later this year. I love fasting for many reasons, but fasting can be nuanced, right? Fasting can be too much of a stressor for some people and certain types of fasting. So fasting can actually increase your reverse T3, and just like cutting your calories a lot. I remember talking to a client in the last like month or two, when she started with me, she was telling me she's eating like under 1,000 calories. That's going to increase your reverse T3. So no wonder you feel tired, right? Again, that reverse T3 is blocking that spot on your cell where your T3 would come and say, let's make energy. Let's have energy to do life, right? Your reverse T3 is then blocking that. So this is another one where I tell like women that are trying to, like that client, women that are trying to lose weight and they're cutting their calories a lot in order to lose weight, but then they're not losing weight. I'm like, yeah, because you're literally slowing down your metabolism by cutting your calories too much. So that's not necessarily what we're talking about today, but hey, that's actually how it works. So I think I'm only going to talk about, I've got like a bunch more things to talk about, but for sake of keeping this short and sweet. So there's a couple ratios. So those are like tests. So TSH, total T3, reverse T3, free T3, total T4, total free T4. Then there's some ratios that a lot of times labs will give you. So we look at our ratio of free T3 to reverse T3, and that one, obviously, we want to, okay, a ratio, like, are we making more reverse T3 than free T3, right? That would tell us, like, as we just talked about, do we have some of these conditions going on? Do we have inflammation? Do we have, malnutrition, nutrient deficiency that's increasing that amount of reverse T3 and like affecting that ratio? But another one we can see is looking at the ratio of free T3 to free T4. So again, remember, T4 gets converted into T3. So when we look at the ratio between those two, we can see, are we having a conversion issue? Like, is your body having a hard time converting from that less active form T4 to that T3? That ratio is going to be affected. So a high free T3 to free T4 ratio is usually, so you'd have, let me think about how that works. I always forget I think about it as like dividing, but that is more like hyperactive. So hyperactive thyroid disease, hyperactive thyroid or hyperthyroidism, Graves' disease, which is an autoimmune hyperthyroid, things like that can be, if you have that high free T3 to T4 ratio. Or the reverse, if you have a low T3 to T4, can show you have lower thyroid function. It can also show, this can also show up if you are on T4 only replacement. So we're going to get into this in the next episode, but one of the treatments I think most people know about for thyroid disease is levothyroxine or Synthroid. And that is actually replacing and supplementing T4. So if you're giving a lot of T4 to somebody, but they're still not converting it into T3, we can see that ratio being off. There's a few, I want to talk about two more. So there's a few other tests. There's also T3 uptake, free thyroxine index, but they're just another way to look at some of the things that we've already talked about. But I want to talk about thyroid antibodies. So this is a test that I'm curious how many people actually have this test done. So typically this is not a test. Thyroid antibodies, let me back up. Thyroid antibodies would show if you have autoimmune thyroid disease. And if you remember, we talked about in the last episode, and spoiler alert if you haven't listened to it, in the last episode, we talked about how autoimmune thyroid disease is the most common cause. Autoimmune hypothyroidism is the most common cause of hypothyroidism in westernized countries like the US. So the majority of cases of hypothyroidism are autoimmune thyroid disease. And what that means is that your body, so autoimmunity means your body is attacking itself. And it does that. What we see is that your body is making antibodies. So one of the antibodies in particular that we can see, so if we have autoimmune hypothyroidism, which is also known as Hashimoto's, so if you've been told you have Hashimoto's, we actually test the level of antibodies. You'll see this, like the test, it might say thyroid peroxidase antibodies. It might also say TPO. And what that is thyroid peroxidase is actually an enzyme that helps to make your thyroid hormones. So thyroid peroxidase is what attaches, remember we talked about, so your thyroid hormones are made from iodine. Thyroid peroxidase helps to attach iodine molecules to an amino acid. Super sciencey. You probably don't care about that. But what the antibody does, the antibody actually affects that enzyme so that the enzyme can't make the thyroid hormone and attach the amino acid to the molecule of iodine. So if you have thyroid peroxidase antibodies present, that can indicate that you have that autoimmune hypothyroidism or Hashimoto's. And we just have to think, okay, that it's how it's working is it's keeping your thyroid from making the thyroid hormones by attacking that enzyme is like the gist. But what we'll see is I actually reviewed labs on a patient today. Last year, her doctor had tested this on her, and hers level was like around 800, which is pretty high. When we tested her within the last month, her level is down to like a 500. So we're doing things to help lower that level there because that's just going to help with her overall symptoms. I will tell you, in the conventional medicine setting, they don't necessarily monitor that. It's just like, oh, if it's high, you have Hashimoto's, there's nothing else to do. But what we find in practice and in your more holistic, functional, natural setting is that the lower your TPO is, the lower your level of thyroid peroxidase antibodies are, the better you feel. And it makes sense, right? Because if you have these antibodies, they're keeping your thyroid from making adequate levels of thyroid hormone. All right. And something else to note is just that your thyroid actually stores. So your thyroid makes thyroid hormone, and it actually stores thyroid hormone like in the gland itself. It stores about 100 days worth of thyroid hormone. When you have thyroid antibodies, like the thyroid peroxidase antibodies, that and it's attacking that thyroid peroxidase, what happens is that you can have an early autoimmunity. So maybe you just start making these antibodies, right? For, again, another podcast topic for another day, but you developed autoimmunity. You have these antibodies now affecting that enzyme. What happens is that you can have a release of the stored T4 into the bloodstream. And why this is important is because people with Hashimoto's can actually have symptoms of hyper or overactive thyroid function in the beginning and then develop hypothyroidism. I've seen this in patients and clients and a friend. She developed this after having a baby. That's pretty not uncommon for women to develop hypothyroidism after babies, postpartum. And that's what happened with her is she actually had symptoms of high thyroid function or over hyperthyroid function. And then she developed hypothyroid function, and she again had autoimmunity. And that reason is because those enzymes get destroyed, which causes this release of the stored T4. And so you can actually, if you test, you might see if it's early Hashimoto's, you can see high levels of T4, but then lower levels of T4 later. So if that's you, that's what the heck is going on, right? It might sound confused, like, why would you have hyperthyroidism and then hypo? And that's the reason. That's what's going on. So then there is another thyroid antibody. So I know when I test, we can check thyroid antibodies, and it's going to check TPO, and then it also checks thyroglobulin antibodies. This is positive in a small amount of people, but again, it's an antibody, so it indicates autoimmune thyroid disease. Thyroglobulin antibodies can be present in Hashimoto's, which is autoimmune hypothyroidism, but it also can be present if somebody has Graves' disease, which is autoimmune hyperthyroid function. So I'm hoping this is helpful. Please give me your feedback on this one. All right. So then I'm going to dive into a little real quick before we wrap this up. Gosh, we're almost at 30 minutes. Is like testing the thyroid. What are things that actually affect your thyroid test, especially if you're somebody who has hypothyroidism? This would be good to know, especially if you're somebody, I hear this all the time where they're like, every time, like, it takes forever to get you on a stable dose, so if your doctor's like, you test and your TSH is high, and then you test and your TSH is low, and they like have a really hard time finding a stable dose on you, these are some things to pay attention to that might actually be affecting your levels. So number one is that biotin, or it's vitamin B7, actually affects our levels of thyroid hormone. So biotin can cause falsely elevated levels of free T4 and free T3, and falsely low TSH. So it could give you a more hyperthyroidism picture. So again, that low TSH and then high free T3 and free T4. So if you are somebody who, you're getting thyroid tests done and you're on biotin. Remember, biotin it's in a lot of multivitamins or prenatals or things like that. So check if you're taking supplements and you're getting your thyroid tested, check for biotin. If you are taking biotin, you want to make sure you stop it for about 3 to 5 days before you have your blood work drawn. Okay. So next one is there an ideal time of your cycle to test your thyroid? So if you remember earlier in the episode, we talked about when your estrogen is high, that will affect your thyroid levels. So what we have to do is if you're a woman who is normally cycling, I should say that. So if you haven't gone through menopause yet, you still have your even if this is important, if you have had a hysterectomy, you still have your ovaries and you haven't gone through menopause, your ovaries are still functioning, you're still having fluctuations in your hormones throughout the cycle, throughout like your 30-day cycle. What I mean cycle, not necessarily your period, but your month to month cycle. And then if you're not on birth control, you're not on, you don't have an IUD or a Nexplanon or something like that. If you are on hormone replacement, that's going to affect your hormone levels should be more steady. Versus if you have a natural cycle, you're not on birth control, you're not on any hormones, and your hormones should be fluctuating naturally during the month, then you actually want to get your thyroid tested when your estrogen levels are the lowest so that you don't have those false elevations in some of the numbers. And the time when that's going to be is when you're on your period. So when your period starts, what has happened is that your estrogen and progesterone have dropped down, and then you're going to have that's what causes you to actually bleed. You're going to have low levels of particularly estrogen during the time that you're on your period. So again, especially if you're somebody who has hypothyroidism and you're getting these levels checked and it seems like it's all over the place, make sure you're testing when you're on your period each time you get a test, just so that your estrogen levels aren't throwing off your thyroid hormone levels. And then this is a nuanced question. This is a question more for if you are somebody who has hypothyroidism, when is the best time of day? Like, should you get your levels drawn before you take your medicine or after you take your medicine? And so what I'll tell you is that, so again, this is for people that do have hypothyroidism and are on medication. So if you are on, most common, you're on levothyroxine, Synthroid, you're on T4 replacement. So those medications supplement or replace T4, the T4 hormone. You have basically your TSH, there's a long half-life with the drug. So checking your TSH, shouldn't be affected. Your free T3 should not be affected. But remember, levothyroxine, Synthroid is T4 replacement. So you actually can, like if you take your Synthroid, you take your pill, whatever, the levels of free T4 will actually peak about 2 hours after you take your dose. So if you're getting your labs done, you may want to wait and take your medication after you've had your lab. So schedule an early appointment, go get it done early. Take your medication after they have drawn your blood, then that will give a better, more accurate picture versus if you take your medication. Say you get up, you take your medication first thing in the morning at 7, 6, whatever. You go get your labs done, within a couple hours. You can have a falsely elevated free T4 if you're testing right after that dose. Okay. And then the other thing would be some people, this is less common, but you might be on combination replacement, meaning you are on T3 and a combination T3, T4 pill. Same thing is that you want to delay your dose until after you have had the lab drawn, because so your TSH, after taking T3, your TSH can be suppressed for 5 hours, and then you actually have an increase. Your free T3 will peak about 4 hours after taking that T3 dose. So you'd want to, again, just overall, if you are somebody who has thyroid disease, you're getting your levels checked, just wait to take your medication after you had your blood drawn, so that you're not skewing your numbers by the medication. So all right, that was so much to cover. We're over 30 minutes, so I apologize. This was a longer episode today. I didn't even cover everything I was going to cover. So I hope this was super helpful for you. I'd love to hear your comments. If you're watching on YouTube, comment below. If you're watching on one of the podcast platforms, you can always DM me on social media. On Instagram, I'm just at Lori Aikman. And please, 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 if you know a woman who has hypothyroidism, maybe is having symptoms and thinks she has hypothyroidism, please pass this podcast on to her, so that she can it can be like a little more, education in her pocket, so that she can get the help she needs and feel the way she wants to feel, get her body. In the next episode, we're going to be, just to give you a little preview, we're actually going to be diving into treatment. So we talked today about the levels. The next episode, we'll be talking about treatment and what should be expected, what you should be on, things like that, based on your different levels. And are there some natural options out there? I know I hear of that from a lot of women who are like, want to avoid medication as much as possible and want to be on something natural. So make sure you don't miss that episode.